Hello and welcome back to this series on SYNLAB podcast, where we have been discussing how SYNLAB simplifies complete care through convenient testing. My name is Patsy Mokungah. I have been and I'm still your host. And with me here have been my wonderful colleagues. I have here with me Rita, I have Nemeka here, I have Uime and Precious. And we've been having a swell time, I must say, in discussing these topics. You know, right now, it's our final episode. I'm sad to see you go. I know you're sad to see me go. Don't lie. But we're going to talk about comprehensive health through preventive test packages. So I'm going to start with you, Nemeka, and I'm going to ask, why test panels? We've talked about test panels a lot in this series, but why are test panels better or more effective for preventive care rather than just coming and doing one test?
Okay. Thank you very much. We've already talked about that in the past, in the previous episode, but it cannot be overemphasized.
No.
And so doing a standalone test sometimes can give a distorted result, and you will have an impression that you're okay while you're not very okay. So I gave the example of having a high triglyceride when you have done sugar, for example, and you feel it's normal, and then you have a low HDL and all that. But if you didn't do that panel testing, you will not know the true picture of how you stand. And preventive testing, like we do, is always good to have early detections. Yeah, when you have that early detections, you start on time. You make it while the sun shines. You don't wait until things have gone too bad, and then you start doing hush. And so it cannot be overemphasized. It's always advisable to do the panel testing. We have a lot of them. Encourage, and we are still building capacity.
Yes.
Increasing a lot of test panels in SYNLAB.
Okay, so about this test panels, sorry.
Okay, so I would say in addition to that, the body is complex. Sure. So doing one single test is just like a single puzzle. So by the time we do the panel test, it gives you a picture of the puzzle. It makes it complete. And with that, you can easily allow your doctor see your result and know what is wrong with you. You can't say you want to do check your kidney health and you just do a sodium. With that, you won't know which parts, what exactly is wrong with you. So with that, it gives you your doctor a vast knowledge to detect and help you care for your health better.
Yeah, well, to add to that, right, aside the fact that it saves time, because what you should have, started treating, you wait, do one, now you go back to the doctor, go back and this, right? And then it is cost effective, very costly. The panels,
energy effective, safe.
Time
and everything, because like she said, imagine going
back and forth.
Come back.
And I say,
sorry,
let's
try this one again. Let's try this one again. Instead, just do a panel and it covers everything. So talking about panels, I know that in SYNLAB we have a lot of panels. We keep developing panels. So Uime, can you shed some light on what the panels we have? What are we might not mention all, but the most popular ones, that the most effective ones, the ones that our clients reach to very often.
Okay, thank you very much, Patsy, for that question. The most common one our clients usually go for is the wellness packages. And in the wellness packages, we have the platinum, which is the most comprehensive. It checks all the organs in the body. And for the male, it even checks the tumor marker for prostate cancer. For the female, it checks the pap smear, what we call the LBC, for cervical cancer. So that's the most comprehensive. So apart from the platinum wellness, you have the gold wellness, the silver wellness, the blue wellness. But we advising people to go for the platinum because it's more comprehensive.
Cover everything.
Then apart from the wellness, what people now go for now, especially the female, is the lunar packages. We've mentioned this in the previous episode. The lunar packages doesn't just check your organs. In the female system, our hormones plays a very vital role in our well-being. So the lunar panel has the hormones as part of the wellness package. So we have the lunar glow, lunar grace, lunar align, lunar blue, according to the age bracket it covers. Then another one a lot of people go for is the Peachy series. Peachy series is our STI panels. You know, STI, you have the Peachy Plum, Peachy Plum Plus. I remember one of our clients back in Port Harcourt, he actually came, he was just like, oh, I want to do ABC, that's, you know, RVS test. And I was like, okay, sir, why not do this? Check your, you know, he was reluctant, but he now listened, did it. And doing that panel test, you know, we're talking about the advantage of doing the panel test. He now realized other things. You know, he got worried. He spoke with our pathologist, did another further panel test. He was advised to bring his family in for a screening. And, you know, at least he was able to take a well-informed decision that also went along, not just protecting himself, protected his family. And he's been so glad since then that he did that test, you know. So apart from the Peachy series, we have panel tests for domestic staff. You're out there, you don't just go pick anybody from the streets to be your nanny. You have to screen, can this person take care of my kids? Is this person clean enough not to transmit hepatitis A, B, or C, or even the RVS or the TB test? So we have the domestic staff panel that covers this. Then we even have the drivers panel.
Pre-employment.
You want pre-employment panel. You want to employ a driver. Remember, you're the Oga, you're sitting at the back. It's the driver that is holding the wheel. So you need to be sure that your driver is fit enough to drive you wherever you're going to. Then we have panels that could be curated based on organizational need. That's occupational health panels. There are certain organizations that will come to us and like, okay, this set of employees, we want to check this. We want to see if they are fit for this purpose. We want to see, you know. So we curate certain panels to meet their needs. Yeah. Then we have others, specialized panel tests like what we call my PGX. The full meaning of that is my pharmacogenetics. That's a personalized test for you. What it does in brief, let me just quickly summarize, is it works with your DNA, your specific gene, to check what drug will be effective for you. What drug will be effective for the headache you're feeling, the pain you're feeling, your fever, your DVTs, what antibiotics would be good. So it's actually, I always tell my friends, it's a manual you should go with to your doctor. It guides your doctor to treat you fast or manage whatever ailments you're, because the doctor just needs to flip through it. It's just a one in a lifetime test. My PJs, the doctor just flips through it.
And you don't have to troubleshoot.
No,
with
you don't have to play around with medication. No. Okay, I need to give him ibuprofen or paracetamol at this dose. This is what will work. This is what will be toxic. This is what won't work. So it's all in that test. The same thing with NutriHealth.
Yes,
NutriHealth is about food. What food would I eat that is specific to my gene, my DNA, that would work for me? Do I take white protein? Do I take red meat? Fine, people might say, oh, red meat is not good. But funny enough, it might be red meat that is good for you. Like recently, a client actually did the NutriHealth test for her son. The son, I think he kept having allergy. So she just came, she was like, okay, let's do this test. And the boy's gene, what was toxic for him was dairy. That's yogurt, milk, nuts, anything that has to do with cheese.
You can even
certain fruits, certain vegetables. She came back thanking us that thank you for this, that she now avoided those particular class of food. And it resolved the issue. And one thing I love about our NutriHealth test, it doesn't just tell you avoid this or this is good for you. At the end of the day, you're given a recipe, what food. They are giving a recipe, what food to eat, how to prepare it.
Like you said, that thing is like a booklet. By the time you see the results, it's going to tell you everything you need
about your body.
Yes, what you should eat. I really like that test. I've seen, you know, what it looks like when it's done, and it's worth doing for you know, an optimized life. Because a lot of us are doing, you know, will this work? Will that one work? Does this work? purge me? Does it not purge me? What is wrong? You spend another 6 months to a year finding out what might not be wrong, and yet you find this is, and especially for drugs, because there's no drug you're going to take that doesn't have a side effect.
Exactly.
So you can just eliminate that whole process and know that this is the one that works for my system just by taking a test.
The drug one is always so amazing because I have a family friend that did a test. He did the MyPGX test, and when he got the result, he saw fine. Paracetamol is good, it's going to cure this headache. But it was hurting something else.
Causing more damage.
So what was good for him was aspirin.
And
when it comes to pain, and he now stuck to aspirin. And can't remember the last time he called to say, oh, I'm feeling headache, or I need to do this and do that. So
because he just eliminated the problem.
Fixed the problem.
Yeah.
Once and for all. Wow.
So in all of these, our test capabilities makes the work for the clinician very easy.
Very easy.
Yes.
Treatment very easy. The doctor relies on the results. If the results are accurate, things are okay. Becomes a superstar as well.
That's why you need accurate results.
The interesting thing again is, consultants. Once maybe they are confused about anything, they can also speak with our consultant. It's like collaboration.
Yes.
You're not alone in this. Yeah. So it gives, it builds confidence at the end. Yeah.
And you have you kind of know that you have this whole system working for your benefits. The tests, the system is working for you. They have pathologists that will work with your own doctors, will work with your own clinicians to make sure we're really, really big on you getting the best out of your life, your healthcare experience. So we're putting everything in, together to make sure that our client is okay. Our client gets the best out of, and lives the best, highest form of life that you could possibly live, So we were, Rita, I think you said you had an example of a case where a panel kind of revealed something that was glossed over by a specific test.
A client walked in and I want to do full blood counts. I was just, at the front desk. And the phlebotomy is, okay, yes, of course. Thank you for coming to SYNLAB for blood counts. But, it didn't just stop there. Our phlebotomists are trained to engage. Because at every engagement, you want to add value to this patient, right? Why do you want to do a full blood count, ma? She said, I'm just feeling somehow. I don't know. Maybe my blood level is low. See, patient becoming a doctor.
Where did you come up with that?
So, she engaged and, eventually the woman did a platinum wellness. And interestingly, the HbA1c was high. Aside that, there are some parameters in the LFT that were also, not normal, right? And, when she saw a doctor, there's some, they had to do some lifestyle changes, put her on some medications. Imagine she had
just done the full blood count.
She came back.
Normal.
She actually came back to thank the phleb. Like, you did this.
And can you remember, because something like that, like you said, she had to make lifestyle changes. Normally, that's not something you'd have probably thought, I need to take a particular medication, I need to do this. And meanwhile, it's not just that. You actually have to adjust something you are doing on a day-to-day basis that would affect your health. And this is why the panels are really, really much better than just single tests. And I know a lot of people have that habit of that single testing, like, let me just try this one thing. And in the end of the day, you stressed yourself, you stressed your doctor,
money.
You waste money.
And they think they are saving money.
And you think you're saving anything that has, when it comes to healthcare, you have to really be proactive about it. And that's the idea with panels, Okay, so Precious, we have women's healthcare panels, we have panels for men's, we have panels for families, right? I think one panel that we didn't mention, we have like the premarital screening, we even have much more panels. But all these little panels, right? How do you think they help generally in the society, to address unique health needs?
I would say that men and women have different biological system. So something that works for a man won't work for a woman. Like for men, they get to do tests like PSA. For women, it's essential you do tests like the LBC, the cervical screens. Then we have our platinum tests that are specific for the women. We have the ones that are specific for the men. We even have the ones that are family related. We have the ones that are for, let's say, children. Like, I think you mentioned one about the allergies. Your child may not be eating. Your child is going to the toilet. Your child is stooling. By the time you do the allergy test, you know, what is this child allergic to? You know that, the LBC packages for the women, you do it, I think every 3 years, right? Correct me, yeah. Every 3 years, you do the LBC packages. You do the LBC screen to check for cervical cancer. Then the men, you do the PSA to check for your prostates. I believe once you're above, from 40 years and above, or maybe 35 and above, you do. So with that, you get to get specific tests. Then also our lunar packages for our women. I know we've been emphasizing on the lunar because it
by
is
the end
important.
Of this thing, you've not done lunar.
It
You've
is
not
important.
Gone to book tests. Have you listened to this podcast?
Because it checks for right from fertility age, from your fertility age down to your menopausal age. So from your 20s down to your 60s, you get to know, why is my hormone reacting the way it reacts?
There's a test for everybody. There's a test for everybody, and it kind of just for
every age bracket.
For every age bracket, it's in every age bracket, every sex, every
class.
Occupation, everybody shall covered. And everybody shall. And I think so. We can say that this is a service that's been done to the society as at large. Everybody's covered. There's something for everyone out there, and at this point, I think we have fully established that SYNLAB has gone above and beyond to, create this environment that enables health, enables you thriving with your health. And what we've done is put the power in your hands now to determine just how well you enjoy your health. We've brought healthcare to your doorstep. It's health. You can access healthcare in your bedroom, your living room, while you're Netflixing and chilling. You can access healthcare for yourself, for your loved ones, your children, your spouses, your partners. You can access healthcare for your colleagues, the people you employ. You can access healthcare for them, for your church members, for, everybody is involved and we can come to you. So basically, we've created this environment that enables you to make the best decisions whatsoever for your health. And it's now time for you to sit up and say, you know what, I'm going to take my healthcare into my hands. I'm going to make this decision by going to www.synlab.com.ng. I'm going to book a test, or I'm going to check which location is nearest to me. I'm going to walk in. I'm going to have this wonderful experience while I get my money's worth, and I, put my health at the forefront of my life. And I know that for the next 5, 10, 15, 20, 25 years, I'm going to enjoy premium health because I took the initiative. So I'm encouraging you right now, to be proactive. Book a wellness test today. Book Luna today. Book Peachy today. Just book our Nutri-Health tests. Go all the way. We like to live the soft life. In living the soft life, exhaust yourself on the front of healthcare. And I think we've done a lot. We've explained to you so many ways you can access this. It's been a wonderful series. I'm very, very happy to have had you here with me and to have my colleagues here with me. Right before we round up this particular episode, it's our SYNLAB board. I know you should know this. If you're new here, we always sign this, and it's a new year. See how clean it is? I'm about to destroy that. So I would like you guys to sign. I'm very, very happy about the fact that it gets to be SYNLAB people that start this podcast for 2026 with us. So everybody's going to sign right now before we leave. And while we're signing, don't forget to like.
Watch the cup.
I expect that you've left a comment by now. I expect that you've subscribed to this podcast and you've shared this podcast to everybody. Even our social media people, they are optimizing. Now you can share from Instagram to WhatsApp to everything. So share this podcast on YouTube, share it on Spotify. We'll be back again and again and again with so much more health content for you, teaching you how to, optimize healthcare for yourself. Thank you so much for being here with us. I'd like to thank my colleagues. Thank you, Ime. Thank you, Precious. Thank you, Rita. Thank you very much, Nemeka.
Thank you.
Thank you so much, our customers, our clients. We love you, and we'll see you next time. Goodbye.
Bye.
Bye.